If you don't know where to begin, better ask Win.
Shane, so good to see you. A really surprising story today. We're talking about the ACA cliff, the $1 income mistake that could cost you thousands in health insurance. One of the biggest surprises people face when retiring early has nothing to do with investments, it's healthcare. And starting this year, a little known rule under the ACA is creating a shocking outcome. Earning just $1 extra of income can cost you thousands in additional premium costs. Can you explain here what changed?
Well, if we look at these two lines, we have 2025 and 2026. Blue line there is 2025. You see a pretty gradual movement upwards as we go right. But if we look at that orange line, this is the new rules for 2026. If you have over $82,000 in taxable income, your premiums will jump up significantly to that newer, higher elevated line there we see in orange. So you want to make sure that you don't run into that cliff. Could be a pretty costly mistake if you don't plan for it.
Right. So what does this mean for people then who need healthcare before they're eligible for Medicare at age 65?
Well, yeah, I just want to reiterate that. This is all about those people who want to retire at, say, 55 and have a gap between employer plan and Medicare kicking in. So what you want to make sure you do is have a plan in place to address this and make sure you keep your taxable income low in these earlier years of your early retirement prior to Medicare. Otherwise, you might wind up paying a lot more than you want to.
Mm-hmm. Yeah. And who gets hit the hardest with this then?
Well, it's going to be those folks that want to retire early, like we've been talking about, who maybe didn't necessarily have a plan, and maybe they planned for Medicare taxes later in life or IRMA penalties. Maybe they planned for tax-free income later to avoid things like Social Security tax and income tax, but failed to notice this newer area that's popping up here for early retirees with this healthcare jump up.
So Shane, let's say that I come into your office today and I tell you I want to retire at 55 or 60. What can I do now to avoid this income trap later?
Well, we want to talk about your income sources primarily, because so many of these things, whether it's this new jump in healthcare or it's Social Security taxation, ordinary income taxation, capital gains, Medicare, all these different things that exist, they're pretty much all based around your taxable income. That's what triggers all of these things. And so if we can diversify your tax class or the status of the tax class of your different accounts, diversify the tax status of your income streams, we can start to actually put together a plan that manages all these different thresholds that exist out there and avoid some of these traps. Roth conversions primarily would be a very likely conversation we'd have to move money from always taxable to never taxable, because a tax-free dollar, whether it's an early retirement or later in life, won't trigger so many of these traps that exist out there.
Mm-hmm. And, just to kind of reiterate this, it all comes back to proactive planning, because income isn't just about taxes anymore. It's also going to directly affect your healthcare costs as well.
It is. And that's why we want to make sure that when we do put together a plan, we start always with income, investments, but then taxes and healthcare are a huge part of that, because it's really all interconnected. And if you don't account for all these different moving parts, you may get tripped up later on.
Mm-hmm. Right. Well, Shane, then if somebody would love to retire early, obviously the sooner the better if they create a plan, what's the best way to sit down with you?
The best way to reach us is online or via phone. Our website is winstonandcompanies.com, or call us here at the office, 602-456-1928.
Great. Shane, thank you very much.
Thanks, Erin.
Got a plan for your retirement, 'cause you know it's just down the road. But if you don't know where to begin, better ask Win.